So what is eczema? Eczema is a chronic inflammatory skin condition marked by red, dry, itchy, sometimes oozing or thickened patches of skin. It's often part of what we call the atopic triad. Atopic triad is these three conditions that often appear together, and they include eczema, asthma, and allergies. And it's actually very common to see somebody in our clinic who comes with an eczema as their main issue. And then during the initial intake, I find out that they have been suffering with asthma and allergies as well. And even for somebody who's not a medical person, who's not in medicine, it is intuitive to assume that having this triad means that something is going on with the immune system. And that's why eczema is not just about the skin. Of course, at its core, eczema does involve a compromised skin barrier, and that makes the skin more vulnerable to irritants, allergens, microbes, and environmental stressors. But there's also a very important second component of eczema, and that is an overactive immune system that drives this inflammation. So let's look at eczema from conventional medicine standpoint. So in conventional dermatology, eczema is seen as a chronic skin disease. The focus is on managing symptoms and preventing flare-ups. The main goals are to reduce inflammation, repair the skin barrier, control itching, and prevent infection. And here's how it's done. We use moisturizers, emollients, and these are the foundation of eczema care. They help seal in moisture and restore the skin barrier. Thick creams or ointments like Aquaphor, CeraVe, or my favorite Vaseline are usually recommended for eczema. Then we have topical corticosteroids, and these reduce redness, itching, and swelling, especially during flare-ups. And they come in different strengths, but long-term use is discouraged because it can thin the skin, so they're usually used carefully for about 2 weeks at a time. Next is topical calcineurin inhibitors, drugs like tacrolimus, Protopic. These are non-steroid options, so they're often used on delicate areas like the face or eyelids. In some cases, antibiotics are prescribed, and this is because skin that is affected with eczema is prone to bacterial infections, especially with Staph aureus. So oozing, crusting, or yellowish exudate are sometimes signs of a superimposed infection. Then we have biologic therapies, and those are the type of medications that are heavily featured in the TV ads. So these drugs are used for severe or difficult to treat eczema. For example, dupilumab is used to block specific immune pathways to calm inflammation. Usually biologics are injected. Unlike topical creams, they have an effect on the whole body and unfortunately can lead to whole body side effects as well. Then there's also phototherapy, special light treatments in dermatology offices that can reduce immune overactivity in the skin. The main limitation of these conventional treatments is that they often help manage symptoms, but of course, they don't always address why the skin is inflamed in the first place. And that's where functional medicine brings a complementary, I would like to say again, complementary perspective.